From BLC Studios in Mankato, Minnesota, this is the Bethany Vikings podcast, hosted by Brock Aker.
Welcome to another episode of the Bethany Vikings podcast. I'm Brock Aker. I'm joined by Gabe Stays, who's been on the show before. How are you doing, Gabe?
I'm doing pretty well. The weather is nice down here in Arkansas.
Yeah, Arkansas, one of the only students that go to Arkansas according to our professor club, and that's pretty good accomplishment, huh? Do you know anyone from Arkansas until you moved over there?
No, just my grandparents.
Well, I'm glad you got some good weather there in Arkansas. Today, though, for the episode, I'm going to interview Dr. Sara Traylor, the nursing director here at Bethany Lutheran College. But before that, I just want to talk about what these next 4 episodes after this week on the Bethany Viking podcast will be like. We're going to have our own mini little tournament here on the Bethany Vikings podcast by playing the game Initials. I don't know if you guys know what the game Initials is, but it's from the Power Trip morning show on K-Fan. They play it at 8:20 every Friday morning, and they've just finished their 301st game last Friday. It's pretty fun game. Corey Cove created it. It's a game where contestants are given 12 items, which can be people, places, or things. Each item has the same initials. Contestants are given up to 6 clues for each item. So how people buzz in, they say their name. The first person to ring in saying their name, so Gabe, if you're in it, you just say Gabe. If you said that name before anyone else, you have 5 seconds to answer. But there's no cell phones. I got to figure out a way where I know the contestants aren't cheating on the cell phones, because we know how that is nowadays.
Oh, come on, Brock. We're all honest here. No one's going to be doing that.
Yeah, right. I don't know what team would do that. Maybe the golf team. I don't know. But they can ring in only once. After they ring in, if they get it right, then they get 1 point. There's 12 rounds. If they get it wrong, then they're out for the rest of that round. And each of the 12 items is worth 1 point. And then the winner of the initials will go to the championship round, because there's 15 different Bethany athletic teams. So we're going to have a contestant from each team. So the opening rounds will be 3 rounds, contestants of 5, and the 3 winners will go and play each other in the championship. That will come out on semester final week, that May opening week. And that'll be to see which Bethany athletic team is superior in the game Initials. So we already have 7 commits. Some big names here. Trenton Krieger is going to be the contestant for the Vikings basketball team, men's basketball team. They're all Vikings. I don't know where I was going with that. Allison Lauer, she's going to be the girls golf contestant. Logan Nesson, the senior pitcher, the closer for the Vikings last year. He played for the Rochester Honkers. Big name there. He's going to be the baseball contestant. Taylor Kopke for softball. Jakin Anderson for men's cross country. He'll represent them. And then Keegan Rich, he almost has all the records here at Bethany for track and field. He'll represent the men's track and field. Tom, your teammate, is going to represent the golf team, the men's golf team. Hannah Geisfeld is going to represent the girls basketball team. And the last commit we have so far, Marissa Voss for the girls track and field team. Some big names there, aren't there, Gabe?
Yeah, absolutely. Tom, if you're listening to this, you better represent us well, buddy.
Yeah, I hope Tom is listening to this. It's going to be fun. We'll see which team is superior. But before we get to the interview with Dr. Sara Traylor, we have some breaking news that just came out this afternoon. It's April 6th when we're taping this episode. And right around lunchtime today, Gabe, news came out that Bethany Lutheran College men's basketball coach Matt Fletcher is resigning from basketball and girls golf duties. He's going to take the job at Concordia University St. Paul as the men's basketball coach. How surprised were you by this news?
Well, Brock, you were the one who broke the news to me, and I think like almost everyone else, I was shocked at first. I mean, how can you not be with all that he's done for the program, and even in just 4 years? He's so committed to his work. He's committed to the betterment of the program that no matter when he left, whether it be now or even 5 years from now, it was always going to be a shock to see him leave. But with that said, I'd been wondering for a while just how long we could hold on to him because of all the success that he's had. And everyone, I mean, his players, those who have coached with him, have the highest respect for him. So you knew that there was going to be opportunities for him to move up the coaching ranks in his career. So even though it's shocking right now, he ultimately decided that it was the best choice for him, and we absolutely congratulate him on that.
Yeah, he definitely left his imprint on the program, men's basketball and women's golf coach. Some people forget about that. He was the women's golf coach as well, and he actually won Coach of the Year for the women's golf team this past fall. For basketball, though, he took the team to 2 NCAA tournament games. The first one was a couple years ago. They played St. John's. They won the UMAC conference tournament that year. They even won the regular season that year, and they upset the number 7 team, St. John's. And then this past year, they won the UMAC tournament again. So 2 out of the 4 years his team won the UMAC tournament, finishing in his 4 years with a 76-33 record. What kind of impact did he leave, Gabe? What's your
Well, you
insight on that?
said 76 wins the past 4 seasons, as you said. The previous 4 seasons, just prior to his arrival, Bethany had 33 total wins uh, for their basketball team. We've seen the passion that he has for his players, his desire to have them be their absolute best, and he has modeled that with his "Be Different" motto. And then you look at the ability to turn this program around through coaching, through recruiting, and it's really been remarkable. So, as Don Westfall said earlier in his statement, he said it wouldn't be the least bit surprising for him to go into Concordia St. Paul and have them competing for championships within just a couple of seasons. So they're coming off some tough seasons too, but that's something that Fletcher is familiar with coming into the program.
Yeah, Concordia St. Paul, where he's going, is a D2 school for people that don't know that. It's in the NSIC, very competitive D2 league. Northern State's been dominating that conference for basketball the last couple of years. And Augustana's pretty good. And the interesting thing is SMSU is in that conference as well, where Fletcher played his college ball. So I'll be interested in him playing his former school.
Yes, it will be.
All right. Why does it make sense for Fletcher to leave here?
Well, we said Concordia St. Paul, they've got 29 wins in the last 4 seasons. So if you look at this from his perspective, possibly, he gets a chance to go to a D2 school, the conference that he should be somewhat familiar with. And this is another challenge for him. Can he come in, invest in the program, and make them a championship contender in the NSIC? So it could be a big stepping stone for his career if he wants to continue to climb the coaching rank. I lost you, Brock, there.
Yeah, I think we had a
I can hear you.
little frozen up a little bit. So you're talking about why it makes sense. He's going to a D2 school. They only won 29 games, and I think that's
Yep.
when we kind of froze off a little bit there.
Okay, well, yeah. So I can't see you right now, but for him, he views this as another challenge. Can he come in, invest in the program, and can he make them a championship contender in the NSIC? And for him, he views it as if he can do it, it'll be another big stepping stone for him if he wants to continue to climb the coaching ranks.
Yeah, this is Zoom technology right here, so we're going to just keep going with it. But yeah, I think it's a good stepping stone, like you said. This is just the start, I think, for Fletcher. He's a very good coach. He's really good with this Bethany community. He's involved a lot here. And the Northern State head coach that just left a year ago, he actually is a coach for North Dakota, a D1. So like you said, this is not to say that Fletcher's going to just stop at D2. He's a very young coach. He could keep moving up, and we might even see him in D1 very soon. So I'm excited for him at least to see where this all takes him. And I think he definitely has done a lot for the Bethany Vikings program. So with that said, now there's an opening for the Bethany basketball team, and you got to think it might be a hot spot, especially in the D3 realm, as we have been very successful now. We still have Kyrie Mayfield coming back, Brian Smith, Hunter Nielsen's going to take the next step. We got a lot. Jared Milinkovic, he's picked it up a lot, scoring the ball last year, and he's obviously one of the better defenders. Who could possibly maybe fill in as coach now for the Vikings?
Well, I don't want to speculate on any specific person, but the challenge now becomes hiring a coach that has the same type of dedication that Fletcher had, and someone who can come in and make the players buy into his system. You said it. There's a lot of talent on the roster, and the roster is filled with shooters. And even you look at the players that Fletcher recruited for this next season, more shooters coming in. So in my opinion, it'd be wise for whoever the next coach is to have a similar offensive philosophy, make use of all those shooters, and hopefully the program can continue to build on the championship culture that has already been started.
All right, I'll just end it here with this. This is the statement that Coach Fletcher came out with today. He starts off saying, quote, "I would like to thank President Pfeiffer and Don Westfall for giving me the opportunity to lead their men's basketball program the past 4 seasons. I'm blown away by the amount of great people I have met, amazing players I've gotten to coach, and families I've gotten to know. When I came to BLC, I was unsure where it would lead our family. We have had an amazing 4 years here in Mankato, and we'll miss everyone dearly. Thank you for all the support and passion this place gave our program. My family and I will always be Vikings," close quote. Yeah, Fletcher definitely will be missed. I appreciate he's been on the episode or a couple of podcast episodes here, helping us kickstart this. He's really good in the community, and I'll deeply miss him on campus, and I wish him luck with his future career.
Absolutely.
All right, we'll get going now to the interview about COVID-19 with Dr. Sara Traylor. We are now joined by Dr. Sara Traylor, who's the director of the Bethany Nursing Program. She has a PhD. Welcome to the show, Dr. Traylor. How are you doing today?
I'm good.
Okay, sorry. I think that just fizzled out for a second. That's good. So you're at campus right now? Is that correct?
I am, yes.
So I just want your opinion just to start. So the COVID-19, how the situation all came about. Why are we not having school? Why are we in our house? Can you just, what's your opinion and why? Some people probably, even like kids too, don't know why we're doing this. Why is the COVID-19 such a big deal?
Well, it's a virus, and viruses spread very easily. It's a communicable disease. And so why we are not meeting on campus and have the stay at home in place is to help decrease the curve of. So it may not feel like we're doing something, but we actually are. By staying at home, we're limiting the spread of the virus to other populations, particularly those at risk. And so by doing that, we are also giving the health systems time to adjust and meet the needs of those that do end up testing positive or having the disease.
Okay, Minnesota has a stay-at-home order, and a lot of states have that. I'm actually from South Dakota, and we don't have that. Our governor, Kristi Noem, thinks we can get through this without taking those extreme measures. With your opinion, with your credible source, who do you think – I know I'm putting you on the spot, but what is the right decision you think? Stay-at-home order or just being smart and limit it to less than 10 people?
I'm a proponent of the stay-at-home order. We can't see the virus. I think if it was visible, people might change their minds. Sort of walking into this minefield of virus molecules, running rampant. So I agree with a stay-at-home order because it helps decrease the curve of what's going to happen when a whole bunch of people end up testing positive or have active symptoms at the same time. The US healthcare system in general is not ready for that. And so by having orders like stay at home in place, it helps decrease that curve so that people so healthcare providers, hospitals, clinics, whatever, can address people that are active, and then use the resources there, but still have resources for the next number of patients that come in.
You talk about symptoms. If you're a nurse, what are you most worried about if there's a patient that comes in? What are maybe let's just say top 2 symptoms that?
The top symptoms are fever, and cough, difficulty breathing. It's a respiratory virus, and so we look at the respiratory system. And then because it's an infection, our body's fighting it, so we look at, that's why we then get a fever. So that is why we see people wearing masks, and, face shields, because it is a respiratory virus and spreads that way.
So there's some cases, like I think you said, that are asymptomatic. So is that kind of scary too, like you said, because we can't test everyone, and some people don't know it. Like, how can you put a control over the COVID-19 if we don't know if we have it and we can't test everyone?
Well, if we don't know who has it, we can't test everyone. So we do the best with what we can control, because it is a virus that nobody can control. So what we can control is how much physical interaction we have with people. And by limiting that, we are limiting the probability of me carrying this virus and not being aware of it. And then, let's say an older adult who also has underlying health conditions, now they can get violently sick, but it might not even affect me, but I could have given it to them. And so that is the risk with this disease, and why we have to be careful, even though we don't or know we don't have it, is that the potential is there that we do have it, and to limit contact so that we don't spread it to people that would not be able to recover from it.
So kind of backtracking a little bit, it's stated that this virus came from a meat factory in Wuhan, China. There's some other conflicting reports. I saw United Kingdom think it started actually in a Chinese laboratory. Do you know exactly where it came from? And also, could there be different viruses that could come out because it came from a meat plant or wherever? Does that mean there's other viruses that can just come out of nowhere?
Don't know 100% where it came from. It is a family of viruses. And so as with any virus, there's sort of different forms. So for example, it's a similar idea with influenza. Influenza is not the same form every year. And so that's why there's a different type of flu shot every year. So it's the same thing with this, with the family of coronaviruses. My understanding is that it did come from, originate in bats. So it was the animal able to carry over and transition into the human population. So that's what I know about it. I haven't done a whole lot of research on that. But regardless, we don't have a vaccine. And it sprang up out of nowhere because I think it was something that we weren't ever expecting to have to deal with. With that said, it is the same family as the SARS virus from a few years ago, and I believe also H1N1. So they all kind of originate from the same umbrella of the coronavirus family.
You talk about a vaccine. I heard that usually for FDA approved, it takes about 18 months. You said at PhD, you actually do some research, so you might have a little background on how fast things move. How fast do you think we could get a vaccine that it's actually hasn't have side effects and we can give it to everyone?
So I know they started working on it relatively quickly. I think realistically, it would take from when they started, and I'm not sure an exact date, but I know they've already been working on it for a couple months. I would say safely a year from when they started working on it. So if we assume they didn't start working on it heavily until January or February, we might not even have anything until next year. But I don't do the lab side of research, but that is what I know of how viruses, the progression of virus, and then to be able to make an antibody to attack it. That's just sort of how the timeline of viruses and antibodies works.
Okay, we see now, I saw on NBC News that the death toll is over 10,000 now as of noon today. And Dr. Fauci, who works in the White House or whatever with Trump, said he expects to be about 100,000 to 200,000 deaths in the peak. When do you think the peak is coming? When we'll even see the fatalities even increase more than they are right now?
So I think it's good to remember, or to remind ourselves, that although the death rate is high, or the projection is high, that is accounted for in our precautions that we're taking, the stay-at-home orders, wearing masks, etc. If we were not doing that, the numbers would be significantly higher. So there's already evidence that what we are doing is working. As far as the peak, last time I looked, the peak I think they're projecting for Minnesota is April 23rd or something. So it's coming. And I think that's, in general, they're looking at the largest peak in most of the, hot spots, middle of April into May.
Okay, so with this COVID-19, is this going to be around now for everyone's lifetime, even if there is a vaccine? Or, like you said, we're quarantined, so if we don't interact with people that have the symptoms, could it just all go away, or is it no one has a magical wand to do that? What do you see?
Well, that's a great question. I think it has the potential to. First of all, I think once a vaccine is developed, we have the ability to prevent the spread of it. I think it has the potential to morph into another virus, or another type of similar virus. I don't know that it's something that we're stuck with for a lifetime, but certainly the longer it takes to get on top of it and come up with a vaccine, the longer it's going to hang out. Whether it's in the U.S., so if you've been watching this, China, they had their peak and now they're sort of slowing down a little bit there. Now Italy, we're seeing the same thing. So that same thing's gonna happen in the U.S., but then it could go to other countries. So it's kind of the wave that we're watching to see what happens.
So I want to get to more of like how we can, in our daily life, be more coherent or know where the virus is and how it can go around and affect people. But with that, what are some of the biggest myths out there that you might be pulling your hair out and like, how are people believing this?
The one that bothers me the most is that there's still people saying in the media that it's a hoax. We have scientific data and we have medical data that says this is not a hoax. It is not a Democrat versus Republican thing. It's of health and science that we have this. So I would say that's the biggest one. The second thing that bothers me is people wearing face masks and gloves, but they're doing it incorrectly, and so it's not even helping, and in fact they could be making things worse. So as any healthcare provider, we wear gloves one time and throw them away. But you can go to the store and see people wear the same pair of gloves as they're roaming around the store picking up things, and then they're wearing the same gloves when they're taking money out of their wallet and handing it to the cashier. And then same with face masks. If you're not using them appropriately, you're not doing anything. Yeah, so that's the other thing that's really bothersome for healthcare providers, and the fact that healthcare facilities are low on. I mean, there's this huge need for personal protective equipment in healthcare facilities, because if they're not low already, they will be low, and yet, society or the public has sort of taken and bought all these resources, but they're not being used correctly.
You alluded to money, and everyone has money. Even in this tough time, I hope people are still doing good. But with money, can the virus go on dollar bills, $20 bills? Can it attach to that? Or is it careful what we do when we, let's say, carry out food, or people go to the bank still in South Dakota? There's banks that are still open. How is money contagious, I guess?
Last report I heard is yes, it can live on those types of surfaces for it's a short period of time, but it is possible. So you could potentially be at risk if you took a package from the store and didn't wipe it down with a sanitizing wipe, and then rubbed your eye or blew your nose or something like that. I think the contact risk is lower on objects and surfaces, but it's still there, which is why we should be cleaning things like our phone, our cell phones, and doorknobs and light switches and stuff like that. It's still possible, yes.
So how long do you think we have left? I know it's a tough question. You might not have the exact answer, but how long will is the stay-at-home order in Minnesota coming up to an end soon?
So Friday was the deadline. And we have not heard from our governor. At this point, we haven't heard yet if that's going to be extended or not. I suspect, because we haven't had the peak here yet, that it will be extended, but that has not been made official.
So do you think we're going to be in our homes pretty much most of the summer, or it's still what's dependent on that we can get out of our house, we can start school in the fall? Like, what's the biggest thing that has to turn for that to happen?
So we have to hit our peak, and then start to see a decline in the number of positive cases, the number of deaths, the number of people visiting the ER. I really hope it doesn't go through the summer, but it's something to be aware of, that's a possibility. I wish we could read the virus like a book and know exactly what it's doing, but all we can do is go off of data on what's been happening and do scientifically based projections.
We have class in the fall. Bethany hopes to come back. What is your opinion, your credible opinion? I know you might not know exactly, but what would you think the percentage of we going in classrooms for the fall semester?
I'm very hopeful. I really hope that we are done with well, obviously we're finishing out the semester in online learning. There's no question about that. I'm hopeful that we'll start to see this turn by June, July, so that we can get back to being on campus and engaging with students, not via screen.
Yeah, last question here. I appreciate your time. So you've obviously had a lot of students that come through the program and graduate. Have you heard it from any of your students in this time, like how much they're working and how busy it's been for them?
So we we don't have December graduates. The nursing program only graduates in May. So what we are trying to do is we spent obviously trying to figure out how to get our seniors done, because one thing that has impacted nursing programs is we can't go to our clinical sites. So the students, they learn in the classroom, and then, for example, they go to the hospital and have a rotation at the hospital, or a long-term care facility. We aren't able to do that because those agencies have put a hold on clinical rotations to keep their resources for their staff. So that was the impact directly to us. So then what we had to do is figure out alternate plans for our graduating seniors who had 90 plus hours of clinical in April. So that's how we were directly affected. And so a lot of it is virtual learning for them on different, active learning platforms. But I am confident they are where they need. They are learning and at the level they need to be at to be able to graduate and pass their licensure exam. They're excited to be done. I know they want to get out and be helping. So they're looking forward to it.
How about the past graduates in the last couple of years that are in the line of right now of working as nurses? Have you heard from past graduates what they're doing right now?
I not directly. I've only talked to a couple, and that was a while ago, so I don't know. I don't have an answer for that one. I know they're still working, but I haven't heard how they're doing in light of the current situation.
Well, thank you, Dr. Sara Traylor, to come on the show and let our audience know exactly what's going on with the COVID-19, and from a very credible source with that too.
Well, you're welcome. I appreciate you tapping into me.
All right, stay safe. Well, that's going to be a wrap for this episode of the Bethany Vikings podcast. Hopefully Zoom works out just a little bit better as we start the first episode of the inaugural season of Bethany Athletics Initials. We'll see 5 faces from different Bethany Athletic teams next week, so be sure to come back and watch that episode or listen to it again on Anchor, Spotify, Google Play, Apple Podcast, or stream it on YouTube, and you can see all the athletic contestants' faces. I just want to wish Coach Fletcher one last good luck, as he is now the head men's basketball coach at Concordia University, St. Paul. Stay safe, everyone. #BeDifferent, and God bless.